started your timer and here is your system. Right, so if you have read and understood considering the surgical anatomy station, kindly tell me what organ are you looking at?
The stomach,
All right, can you tell me the parts of the stomach?
the fundus, the body, the antrum, and the pylorus.
Good. Can you please tell me what is the blood supply and the venous drainage of the stomach?
The blood supply is on the lesser sac, on the lesser curvature by the right and the left gastric arteries, and then on the greater curvature by the right and the left gastromental arteries.
Okay. Which part is supplied by the short gastric artery?
Then the short gastric artery supply the fundus.
Short gastric artery is branch of which vessel?
Pardon?
Short gastric artery is branch of which vessel?
Splenic artery.
Artery, very good. Okay, can you identify number 4 here?
That's the
6.
fundus.
Sorry, it's 6 fundus. Yes. If you can identify this one, is it 2?
Okay, that's the body of the stomach.
Yes. If you can identify here 23.
The duodenum.
First part of it, yes. 19, please.
The pylorus.
Okay, and if you can identify this one, 18.
18. I can't see the cursor.
Yes,
Okay,
here.
okay. The 18 is the antrum.
Pyloric antrum, yes.
Antrum.
Okay, can you tell me how pylorus is formed?
The pylorus is formed from the narrowing of the antrum to
Yes.
give way to lead to the entrance into the duodenum.
Yes, but can you tell me the structure of the anatomical structure of the pylorus? How is it formed? How it contracts and how it works?
Okay, it has a smooth muscle that once it contracts, it propels
the food particles.
Food into the duodenum.
First part of the duodenum. All right, good. Can you tell me what are the structures which are present in the bed of the stomach?
The body of the pancreas.
Yes.
The splenic artery.
Yes.
Then the left renal vein.
Yes.
The spleen.
Spleen, all right, okay. It's more of the on the side, okay.
Yes, those are the ones I can remember now.
All right, okay. Did you tell me the venous drainage of the stomach?
Yes, it's drained by the corresponding vessels into the left into the portal veins, and then also into the splenic vein, then into the portal vein.
And the right gastroepiphytic vein, it drains into superior mesenteric vein.
Yes.
Okay. Can you please tell me if you can identify this image A?
Okay, this is the barium swallow.
Swallow through, yes. So what image A number 6 is showing? All right. If you can tell what number 3 is.
Number 3 is the esophagus.
Yes, barium swallow in the esophagus.
Esophagus.
What is number, if you can describe image B, because
Okay,
here you can see, yes, 1, and this is 3, and this is 3, and here is 2. What are you supposed to be looking at?
Yes, the image in the B shows occlusion or narrowing in the lumen of the
Not
esophagus,
occlusion,
which could
yes.
be due to constriction. Then
Yes.
number 2 is showing a compression from the outside, intrinsic compression on the esophagus, causing obstruction in the lumen.
Yes. Can you
So,
tell me the beginning and the end of the esophagus?
and it starts at the level of the C6,
C6,
and,
yes.
and then it ends in the diaphragmatic ania, esophageal hiatus. That's where it ends, where it joins into the stomach.
Opposite T11. Can you please tell me what is the lining of the esophagus?
Stratified squamous epithelium.
Very good. What is the blood supply of esophagus?
The superior third is supplied by the inferior thyroid artery and vessel. Then the middle one is supplied by the branches from the aorta and then the bronchial artery. Then the distal part is supplied by the left gastric arteries.
And inferior phrenic artery. All right. Can you tell me, how would you define the term Barrett's esophagus?
Is a columnar metaplasia involving the distal third of the esophagus, usually resulting from chronic irritation, and it predisposes patients
into what kind of carcinoma?
Adenocarcinoma.
Very good. How would you define the term eclesia?
The term?
The term eclesia.
Ecclesia.
Yes, please.
Okay, eclesia, I will define it as when there is failure in the relaxation of the lower esophageal sphincters and then abnormality in the lower part of the esophagus. So that prevents proportion of food contents from the esophagus into the stomach. And usually due to absence of mesenteric nervous plexus in the distal esophagus.
Which conditions can result in incomplete relaxation of lower esophageal sphincter? Can you name few conditions?
Yes, the Boba palsy, then ecalesia can also cause it.
Yes.
Then
if a microscopic sample is taken of a patient with eclesia of esophagus, what would you see?
There will be hypertrophy of the muscles in the distal esophagus and then absence of mesenteric nervous nerves.
System. Okay, very good. Can you tell me the lymphatic drainage of the esophagus, please?
The upper third drains into the deep cervical lymph nodes, then the middle third into the mediastina, and then the distal part drains via the left gastric lymph nodes. Good.
Can you tell me this 2 represent what? Indent, it's indent of what?
That's the aortic arch.
Is it aortic arch or is it left atrium? Can you name 2 conditions in which there could be perforation of esophagus?
In which there can be?
There could be perforation of the esophagus.
Okay, esophageal cancer.
All right, very good.
Then corrosion, use of corrosive esophagitis could lead to perforation, and then it also occur post upper GI endoscopy.
Yes.
And then Boavis syndrome.
Very good. Right. Very good. Good. All right. This picture C, 5 and 6. All right. What is that? And what is this for?
Okay.
So this is the lower esophagus.
Okay. Yes. The 4 is the lower esophageal sphincter.
Okay.
And then the 9 is the stomach.
Fundus, yes.
The fundus of the stomach.
Okay, what is here? Can you, this is the last picture.
Yes,
This 4 is what?
the first part of the duodenum.
Very good. Excellent. Yes, that's it. Good. Thank you.